As men, especially as doctors, sometimes we hyper-focus on our career, neglecting other facets of our lives. But that is about to change. This is Dads Before Doctors. Some physicians claim their family is their top priority, but their lives tell a very different story. We'll help each other become family men who are doctors rather than doctors who have families. If it's health, wealth and legacy, emotional well-being, parenting, professional goals, or marriage, we're talking about it. Thanks for listening, and make sure to subscribe. This is Dads Before Doctors, and this is your host, Adam Broussard, MD.
All right, so welcome to Dads Before Doctors podcast. We're joined by Dr. Victor Pena. Welcome to the podcast, Victor, and look forward to chatting with you a little bit more. Can you tell the guys just a little bit about yourself?
Hello, Adam. Thank you very much for having me on your new podcast. I'm very excited to be one of the earlier guests before it blows up and becomes a massive thing. Thank you so much for having me. So my name is Victor Pena, and I suppose we can start at the beginning. I grew up in Mexico City, and I'm the son of a very dedicated and very accomplished pediatric surgeon, and also a very loving dad. And my mom, who was a stay-at-home mom, and so I'm the youngest one of 5 kids, and the eldest one actually passed away of biliary atresia before I was born, and so that kind of shaped. By the time I was born, that kind of shaped the culture in my family, and it pretty much put life and health at the forefront of our priorities. And united the family. Our parents had no time for nonsense, and at the same time, they really instilled in us the value of life and quality time together and things like that. So it really was, it had a big impression on our family. And so since I was a young child, I wanted to be a doctor, just like my dad. And I admired him a lot, but he was very busy. He was very, very busy. He's now 82, so he's that kind of old school kind of surgeon where work was work, and the wife mostly was around for the kids, and the presence of my mom basically made us all sane and relatively decent people. But if my mom had a job or something, it would have been a disaster for the 4 of us. We were a handful. So I'd always wanted to be a doctor. I'd always wanted to be a surgeon, just like my dad, and out of admiration and all that. But as I grew up and I was in high school, I looked into it, and I still wanted to be a doctor. I wanted to be a surgeon. That was my dream. So I went on to study pre-med. I went to college at Hamilton College in New York, did biology. Then I went to a 6-year program in medicine at the Royal College of Surgeons in Ireland. So it's a big difference from American system. It's a longer period. You do a lot of anatomy, a lot of work for 6 years. And then after that, I went on to a surgical path. So I did my internship in Dublin, Ireland, and then a 2-year basic surgical training program. Again, it's a very different structure. And then you kind of build your own training as you go from job to job, from year to year. And I did 5 years of pediatric surgery and 3.5 years of adult surgery. And the plan was always to become a pediatric surgeon. And I know you're a pediatric anesthesiologist, is that right?
That's right.
Yeah. So you you do as many cases as I ever did, and so it's pretty intense, right? It's a pretty intense. It's a great culture. I love the culture of pediatric care because there's no nonsense in terms of. The patient comes first. You can't give out to your patients the way you do with adults.
Absolutely. Everybody's on the same page.
Exactly.
Most of the things we're dealing with are at no fault to the kids, at least until they get to the teenage years and start doing some stupid stuff. But it's very pure, very innocent for the most part. And you're there to help the kids.
That's exactly it, and that's what I loved about it, because my dad always taught me, if you do your job right, you can give this child, 75 years of a productive and healthy and happy life. And so, but I got a lot of insight that I did not want. I was not looking to do general surgery, but I had to do it as part of my training, meaning adult surgery. And it stayed with me. It just really bothered me what I had seen in terms of the lifestyle related diseases that we had been dealing with. But I kept thinking, that's not for me. That I'm doing pediatric surgery, so like you said, I'm going to be focusing on congenital anomalies and stuff like that. But it stayed with me. It stayed with me, and I realized that the entire healthcare system, and this was in the UK and Ireland, but also in the US, is incredibly overloaded with lifestyle-related issues. But it was truly in the back of my mind. I had no other concept of that. So I went on with my career. I ended up doing a clinical serial girlfriend. We're like 3 months into the fellowship. I'm between the cafeteria and the NICU. I'm walking, and I get a call, and she says, "Hey, guess what? I'm pregnant." And I'm like, "Oh, that's awesome. That's great." And then a couple of months later, I learned that she was pregnant with twin girls, and and that just totally rocked my world, right? It's just
no doubt
a complete shift in perspective. So what was interesting is that during up until that point, I had maintained a certain set of conventional expectations, right? With respect to my life-work balance. I had tended to basically reproduce what I had done of working really hard, long hours, and my mom, and my wife filling the role of my mom by basically being a full-time parent and that way raising a family. But once the pregnancy started, I started thinking, I want to be more present in my kid's life. And being in pediatric surgery for 5 years before that, throughout it, that was a really interesting progression that I experienced in my mind. I always loved hanging out with kids, always. I like babysitting, camp counseling, I loved it. But even in surgery, I really enjoyed talking to my patients and stuff. But over time, I remember thinking at the beginning, they're such great kids, but I'm glad they're not my kids, right? It's like, great, take them away. But over time, I started thinking, I wouldn't mind having one of my own, right? And now I always wanted to be a dad, but the maturity, what happened inside my head was really an interesting evolution. And towards the end of those 5 years, I kept thinking, I really want my own kids and to raise them my way and to listen to my kids. And so it really, I evolved. So by the time my girlfriend became pregnant, I thought, let's bring it on. I was ready to be a dad, but that kept clashing with my old-fashioned kind of conception of I'm going to work really hard and I'll barely be home for the weekends. And so those two clashing ideas were in my mind during the pregnancy. And then I came across a one-page article. I don't know if it was Newsweek or Time Magazine, but it was a one-page feature about lifestyle medicine. And they talked about lifestyle medicine. I had never heard a word about it. And I read about it, and I saw that they interviewed the head of the Institute of Lifestyle Medicine at Harvard Medical School, which is Dr. Eddie Phillips. And I thought, that sounds really interesting. Lifestyle medicine, for those who may not know, is the use of evidence-based lifestyle interventions as a primary modality to prevent, treat, and sometimes even reverse chronic disease. And so it sounded to me like, well, what's the difference between that and preventative medicine? But preventative medicine is really more epidemiological and population health kind of thing. And this was kind of like, wow, take the people that I had operated on in general surgery, and instead of debriding their diabetic ulcers, maybe get them to lose weight and quit smoking and start moving more and sleeping better and eating better. And then maybe we would not have those sort of problems. Or the laparotomies that would experience dehiscence, days and weeks later because of their obesity. And it was just I thought, wow, that's it. I want to prevent the suffering that I've seen my patients experience. That was basically the key. And that totally rocked my world. But on top of that, I was thinking, yeah, but I'm going to be a dad, and I'm finally doing my fellowship in surgery. So after a lot of soul searching and talking with my girlfriend, who became my wife, I decided to leave surgery, and it was my baby. It was the thing that I'd always wanted to do. In fact, I remember thinking, I don't want to go to medical school. I want to go to surgical school. Like, if there was such a thing, like, I don't want to be an internist. I want to be a surgeon. So it was the thing that I'd always wanted to do.
I wanted to be an anesthesiologist and pediatric anesthesiologist since I was like 7. So I definitely know that feeling. And similarly, when my wife and I got pregnant with our first son, we were away from family, kind of on that same path. I was the fellowship program director, working, in academics, writing, abstracts and presenting at conferences and all this kind of stuff. And I got the opportunity to move a little bit closer to my current job, so that we're a lot closer to both my wife's family and my family, and work a little bit less and a little bit less involved in some of the other stuff, but still working with residents and enjoying that kind of thing. So definitely kind of know that feeling when it hits you. And it's amazing, especially working in pediatrics, going from not having a child and, kind of like what you said, like seeing them and like, oh, I get to go home, to, now having your own child and you're dealing with, this child that has cancer at work, or, whatever, this 24 weeker or something that you're doing a case on, and it hits you a lot harder all of a sudden when, you're looking at that child and thinking about your child.
Yeah. Absolutely.
So definitely know that feeling there. And I'm sure a lot of our listeners do too. It sounds like you learned a lot from your dad, both, in your drive to do pediatric surgery, but also learned that you wanted to follow in your footsteps that way, but not necessarily the working so hard that you're laying everything on your wife and not being around as much.
Yeah, actually, that's a good point. I noticed, we all, well, most of us, I suppose we can say that we idolize our parents, and especially if you want to follow in their professional footsteps. And my dad, I've gained so much respect for him over the years in different ways and different aspects at different times. But I mean, his work ethic is second to none, and his dedication. But I start noticing personality differences where, it completely fulfills him to be at work, 12 hours a day, and again, into his 80s. Whereas for me, I did a lot of hard work in Ireland. The on-call schedule is kind of like the US back in the 80s. I mean, we would do, 72-hour shifts, and it was just insane. But that was my life. So I didn't have anybody waiting for me at home when I was in training. But as I started imagining myself with a family, I could not imagine doing that and missing all these milestones. I'm just more of a homebody, kind of more dad kind of person. And I think that's one important thing that your listeners can consider, to know themselves, right? Some of us kind of like, just like women say, I'm very maternal, or no, I'm not, like just to know themselves and to not let anybody else's expectations shape that. I mean, maybe they don't need to be with their kids all the time, or maybe they just, whatever it is, but they need to know themselves. And I've realized the difference between myself and my dad. I am not judging him. He was a fantastic dad, but it was just a different temperament and different dedication to work, and then compared to me. And so I knew myself. I knew it early on. I don't think I stayed in surgery too long. It was never a mistake. I miss it once in a while, but I do not regret anything. It's been fantastic. The last thing, my daughters are now 10 years old, and it's been the best decade of my life. And so what I had to do is, well, one thing I want to say is that, as we all know, medical training is a long and arduous journey for most of us, right? There's just there are a handful of geniuses out there that just waltz into it, but most of us have worked pretty hard to get to where we are in medicine. And so after such a long career, like you and me started as children, right? Thinking about it, we go through so many things. It rules our life. It rules your plans for the summer, your plans for college, your plans for everything. Sometimes marriage and family have to wait for your career to be in the right place. And so what I would suggest is once you get to be an attending, put yourself first, put yourself at the center and work around that. Put your wife and your family in the center, and then start building around that your job, your income, your responsibilities, your status, your prestige. All of that has to go outside of that. But it's kind of hard because so many people just keep going and they have their career define the reality afterwards, but that was one of the biggest shifts in my mind. I said, now when I decided to leave surgery, I said, well, if I'm going to reinvent my life and I'm going to leave medicine, because I left clinical medicine overall to do coaching. So I said, if I'm going to pay that huge price in income and in whatever else, in stability and expectations, I'm going to do it my way. So I put myself and my wife and my daughters first. And then I said, what do we need? And then another thing is to separate needs from wants. What do we need to subsist? And then what would we want to have? And that's why I moved from London. I moved my family from London. Well, we lived in France for 5 months to hang out with my wife's family because she's French. But then after that, we moved to Austin, Texas, where my mom and my sister and my nephews are. And it's kind of like the most central place for my family in the US. And so we moved near family. That was a priority. We wanted to be near family. I grew up as one of like 30 something cousins in Mexico. And so I wanted my kids to have their cousins, to hang out on the weekends, to have those relations, that kind of tribal feeling with your family, and not to be isolated in London where we have no family. So I wanted that. So we moved, right? And then I wanted to be my own boss. I said, I've never started a business, but I'm going to be. And then I thought, well, do I care about being called doctor or not doctor or being in clinical? Well, if I'm going to leave surgery, I'm going to do it my way. So I want to sit across somebody and help them, like I said before, prevent them from becoming the suffering patients that I worked with. And so that over my research and 2 years of reskilling, I learned that that's called coaching, right? And so I said, then I want to be a coach. I don't care about the status. I want to be a coach. So I became a health coach. So I worked in face-to-face, one-on-one, usually with people to improve their health so they will never have to walk into a hospital. And so the other additional thing that I would say is, whatever it is that you do, whatever specialty or whatever, just make sure that it's aligned with your personal values. There's so many people kind of doing some sort of other thing, and it's a tug of war. Mm-hmm. Instead of aligning your family values and your personal values with your work. And that's what I did with lifestyle medicine. So my work keeps me healthy, keeps me informed about how to stay healthy, helps me keep my family healthy. And, it's all aligned. It's all the same goal, right? Stay healthy, promote wellness, and make money and enough to live off that. And it's all the same thing, as opposed to this sort of tug of war business where you see doctors that are morbidly obese or chain smoking and suffering because of the stress. And then that's not very sustainable, I think.
Yeah, no, absolutely. And I think that's a big part of this group, is trying to kind of really take a step back and look at your life with intention and design it that way. Someone may, being a dad or being the best dad ever, best husband ever, maybe top of somebody's priority, but it may be a little bit lower on other people's, but just being you. Like some people, like you said, your dad, like being in the hospital 12 hours a day was him. And I just encourage people to really, we kind of follow the same track. Everyone is, you got to check the boxes to get into a good or a good undergrad, a good med school, good residency, whatever, and you end up on this kind of runaway train that you're not really in control. You're just doing what you have to do until you're 65 and you're like, oh, like, what happened?
Yeah, exactly. Where's the hottest place to get buried in? Like where's everybody getting buried in? Well, that's exactly right. And what I've observed in the online and listening to doctors, on social media, the level. I mean, if you step back outside of medicine, right, being in your environment of medical environment, all your friends are doctors or whatever. If you step outside of that, think about where society holds us in doctors in regard to prestige and admiration and trust, and also they assume that, God, it must be sweet to be a doctor, right? You must be really happy, right? And yet there's so many doctors that are not quite satisfied with their lives. In fact, that's an statement, I think. And the way I see it, I get very protective over the medical community. And I think, dude, you've worked hard enough. You deserve to be happy with your life. Like, you should not be a slave to your mortgage or to anything else. So this is where the concept of lifestyle design, I think, is so important. Design your life around you, because you deserve it. You worked your butt off. You have job possibilities all over the US. You have your services are required. You're highly skilled. You deserve to sleep in peace or to spend time with your family if that's what you want. And take a pay cut. Who nobody's measuring your salary, but your quality of life and your sanity, your mental health have to be sustainable. So I think doctors can really benefit, working clinical doctors, unlike me, because now I'm a master of my own schedule, and that's fantastic. And I'm not here to promote people, all your listeners, to leave medicine. We need them. I just went kind of extreme, and I think there are some lessons to be learned from my case, good or bad. I'm just saying, just realize that it can be done. For example, I've heard many doctors say, well, what would I ever do if I left medicine? I could never do anything. I've heard that. Because, by the way, the last 12 years, I've read a lot, and I've heard a lot, and I've consulted a lot of people that just call me informally asking for advice or whatever. And I'm not even giving advice, but I'm just listening. And I'm learning a lot. And there's so many people who are not happy in medicine. Or at the lifestyle medicine conferences, I go there and I meet frustrated doctors who want to do lifestyle medicine, but they're stuck in, let's say, family medicine or pediatrics, and they have to pay the bills, but they want to do lifestyle medicine, right? And so they're kind of trying to work it in there or put in some coaching in there, but they have to pay the bills. They have the day job. So they're really frustrated, they're torn about it. Whereas I feel relief because all I do is health coaching, which is exactly what I want to do. But that's not the only answer, right? Everybody can find a balance in their lives. But the first thing is they need to know that it can be done. I think that message is crucial. You can be a master of your lifestyle. You do not have to take that double academic clinical job that is so respectable, but it makes you miserable,
So you're, walking through the hospital, you just found out you're going to have, a child, and later find out you're going to have twins. So how did you go about that transition? Did you just jump right in, or did you I know the big thing now is everyone has side gigs and whatever. Did you start trying to learn and build up a coaching practice on the side? Med school, we're really taught kind of to be reactive. So how did you learn about some of this proactive healthcare?
Well, that article was I remember exactly where I was sitting. It was in my living room in London. The living room did not even have a coffee table. It just it was a love seat. And I was just sitting there, and I just came across this magazine. I read it, and I was like, wow, that's really cool. And that just started me thinking. So I went to the library and started Googling things. And the first thing was I came across concierge medicine. So I started looking into that whole thing. where it's like doctors seem to live a more balanced lifestyle and have a better relationship with their patients. And then I saw a couple of case studies of people who use technology, like they got scheduled through an app, and there was a pediatrician in San Francisco that did house calls, but it was his business, it was his way. I came across a lot of stories like that, and then I came across the 40% burnout rate of primary physicians, and like just horror stories of doctors losing their practice because of debt, and oncologists not being able to use the chemotherapy they had bought in advance, and so I kept thinking, whoa, this is also complicated. But the initial plan was to move to Austin, get into a family medicine residency, do it for 3 years, so I would get my US license, and then open a health coaching company, health coaching clinic, right? Like a lifestyle medicine health coaching clinic. And then as I was studying for exams and stuff, I thought, but what's the point? I don't want to be a family physician. I actually don't. I've never wanted to do that. And I have so much respect for people who do it, but that's not what I want. I want to health coach, and I don't want to be prescribing medications. And so why am I doing this? Why am I putting myself through that? And the idea was that I would continue to practice as a medical doctor until I actually questioned, do I really want to continue practicing as a medical doctor under that label, right? And I thought, well, that's what I mentioned before, which is, I asked myself, what's the essence of what I want to do? And I literally remember thinking, sitting across somebody, having a conversation, having a relationship, and communicating and educating to improve their health. And I said, is there any other way I can do that? Because you don't need to be a doctor to do that, and or a medical license to do that. And I concluded that, you know what, there's got to be something. So I kept looking until I came across the idea of a health coach. And it was such a new idea 10 years ago. And of course, our ego in the back of the mind says, what? Yeah, you're a medical doctor, you're a surgeon, and now you want to like switch to like short of personal trainer? Like, what are you doing, right? But that's where you have to put I'm not telling people what to do, but that's where I had to put my ego away. And I said, it's not about that. It's about my daily life. I want to do what I want to enjoy, and I want to be around for my family. And that was the answer. The answer was to reskill as a health coach. And then, of course, because of that article, I looked into lifestyle medicine. I did all the lifestyle medicine continuing medical education credits that Harvard had, and then Yale University. And I just started with the online courses just to introduce myself to what this topic was. And then more George Washington University, and like lots and lots of courses online because they were very convenient. I was living in France at the time. And then by the time we moved to Austin, then I started taking it more seriously and getting certified as a health coach, and then joined the conference at the American College of Lifestyle Medicine, and meeting other people to hear their stories about how they're implementing lifestyle medicine. And like I told you, I would say about 80 to 90% of people have day jobs as nurses or doctors or psychologists, and they're trying to implement lifestyle medicine into their practice. So yeah, it was a big transition, and it took me 2 years. I had to live off my life savings, and my wife, with 2 babies, like just going, come on, hopefully this will work. And she was French. So when we moved to the US, she could not work for a while because until her green card came through. And so we were living off our savings. And but I did not hesitate, not a single day, because I said, this is what I want to do. The world needs this, and more importantly, I want to do this. So I had no doubt.
That's wonderful, and I think that's a wonderful mindset to go into this, because I know a lot of physicians, like you said, like feel that way. They're not happy with the way medicine is right now. They want to do something else, but that kind of golden handcuffs, they've got the huge house and the private school tuition and whatever else, and they just feel like they can't do anything else. So they end up putting up with administrators and long hours and whatnot, and just they're miserable. kind of the same thing is we see patients and we tell them to eat right and exercise and whatever, and we're not doing that. We're working 24-hour shifts. We're doing, weigh 300 pounds and not exercising because we're at the hospital too often and stuff like that. I recently read Undo It, and that got me really interested in some of the lifestyle medicine. Like I said, it's not something you learn in med school.
Yeah.
So what are
it's not.
What are some of the big tenets of lifestyle medicine for those that aren't really familiar with it?
Sure. Well, yeah. So I'm glad you asked me that. Thank you, because it's very important to get this message across, I would say. First of all, there's so many, in quote, brands of medicine nowadays out there that is just, wrecking, right? Your mind. I mean, between orthomolecular and energy medicine and God knows how many are coming up, functional medicine. So we have to discern these things. And I did a whole presentation at the American College of Lifestyle Medicine conference about this. It was a call for everyone to just understand we need to make the public know that we are not like this. We are different. And so lifestyle medicine embraces 100% allopathic medicine. It is a branch of allopathic medicine. It is basically, it states, as I said before, that we can address medical problems with lifestyle changes first. And then on top of that, let's say you have hypertension. Well, let's work on your diet, on your exercise, on your stress levels, and see where that gets us. If that still requires medication, then it's fine, perfectly. Use medication, and it's all evidence based, and you focus on what works. It does not pretend to replace anything that cannot otherwise be done, but it does posit that we put lifestyle first. Right? With a baseline of lifestyle, then you add surgery or medication or any other interventions. But it is a crucial difference in mindset, right? And we have all been part of the problem and the solution. But certainly, I'm sure you have. I've examined children that smell like smoke, and I want to say something about it. I want to take the parents aside and educate them. I want to leave them a leaflet. I want to do something like that. But there's no time in a pediatric surgical clinic, right? So we have to have the system around that. So I think health coaches would play a vital role in every medical team, or to have access to health coaches so that you can refer properly, right? If you're a cardiovascular surgeon, you don't have to become a health coach, but use health coaching and lifestyle medicine as a way to get your patients to where you need them to be so you can operate on them safely, right? So it really is a central part. And then we can, of course, discuss the cost effectiveness of it, right? The ROI, the return on investment. It is incredibly, this would be the solution. This is the solution. Lifestyle medicine is the solution to the healthcare crisis in the US. If we became a country like many Asian countries where or Scandinavian countries where physical activity is just part of life, can you imagine what impact it would have on our healthcare system?
Yeah. So and it goes back to that
culture,
intentionality too, and really same thing, designing your life with intention, and not reactively, for your patients and yourself, that you eat well, eat healthy, because we have a whole time with this in the American culture for delayed gratification, but what might taste good in your mouth is killing your blood vessels and your brain and your other organs and whatnot. Like what immediately tastes great is destroying you. So kind of having that mindset and being intentional about it, is a very big shift. So how else do you think, if the listener's not ready to jump in head first and just become a health coach, how can we pull this into our practice? Like you said, I mean, I see plenty of patients that, the parents will say, oh yeah, I smoke, but I smoke outside. You're like, yeah, but you're still
Right.
exposing your kid to it. Like when I intubate them and they have a bronchospasm, it's because you're smoking. Um, so
Yeah.
how do you address some of that stuff to bring it into practice?
So with patients,
Mhm.
or what would I have doctors do? Well,
Both,
the
but
first thing, yeah, the first thing I would do is I would ask if somebody, if a physician or surgeon is interested in lifestyle medicine, I would invite them to visit the American College of Lifestyle Medicine website. Um, it has a lot of educational materials and things like that, and just get acquainted with it. Literally, be able to answer, because as doctors, they need to think, well, what if a patient asks me what's lifestyle medicine? So just to get a little bit fluent on what lifestyle medicine is, and then I think, because most doctors we're always looking for ways to improve our care, the care that we provide. We're always troubleshooting constantly, right? Looking for efficiencies or inefficiencies to solve. And so I think I trust that most doctors, once they know what lifestyle medicine is, they might say, you know what, these sort of patients that keep coming in and taking up our time and we can't help them, maybe they would benefit from seeing a health coach before they come to us, or after we come to it, or after we operate on them, or whatever it is. They will see where a health coach or lifestyle medicine fits in, right? For example, a family physician who's really busy, I've heard this from clients, from my personal clients. They say, oh, my doctor is great, I love them, but he sees me for 7 minutes, literally with a clock in his hand, and he always tells me, oh yeah, and remember to lose weight and exercise. See you in 6 months. My clients say, what's that mean? I don't know, that's why I'm with you, they say to me, right? And that's fine. And if you look at my website, I say, I exist because of the state of the system, right? If the system were perfect, I would not exist. I don't know if I would be working in the system or my services would not be needed. But the point of the matter is that right now, doctors are not meeting the needs of their patients in primary care, at least. And so I would suggest that the doctors think, well, how can we meet their needs? How can we educate these patients so they will be better patients for us, so that our interventions will have more success? Right? That's what we want. Mm-hmm. And it comes down to education and accountability. And that's what health coaches do, among other things. So either bring a health coach on board, or reach out to a health coaching company that can provide health coaches or whatever, or get trained. And I know many doctors and nurses and nurse practitioners and physician assistants who get the diplomate of the American College of Lifestyle Medicine. They get educated themselves in this, and then they integrate it into their practice. So that I know the current president of the ACLM is a cardiologist, and I know that for years she has been incorporating more education and more lifestyle medicine into her cardiology practice, right? And you find cardiologists who just prescribe less and coach more. Now, there's a key issue here that Dean Ornish has been working with for years, the author of Undo It, which is to get coaching and lifestyle medicine reimbursable, right? To make it reimbursable. And so that's going to be key, because the more we can do that, the more a cardiologist can say, well, I talked to my patient for 30 minutes. I coached them. Pay me for that, right? Right now, the incentives are misaligned. Right now, you can write a prescription and get paid X, or spend 25 minutes talking and not get paid anything, right? So that's going to be a real challenge. And it's horrible to say, but at the end of the day, it's about money. Whereas lifestyle medicine, it's about improving lives. We're not trying to make a profit. We're trying to, there's no trademark on broccoli, right? But we're trying to keep people from, at least I am trying to keep people from becoming patients in the first place. And that's the whole purpose of lifestyle medicine.
Yeah, I know. Recently, there was actually a lifestyle medicine talk at the Society for Pediatric Pain Medicine. And they brought up the fact that poor sleep or lack of sleep causes more pain than pain causing lack of sleep. And, talked about some of the, different, going through kind of lifestyle modification, and, patients that have been in pain clinics for years are like, oh, it's fine now. Like, I'm eating better, I'm sleeping better, and like exercising, and now I don't have pain. Like, so you're able to help more patients because, we have, a 6-month waiting list for our pain clinic. So if you're able to help these, patients change their lifestyle, you help that patient completely change their life, but then you allow someone else that's having issues into your clinic so you can help them. So I don't know that, it might not be the money losing thing that sometimes, because there is a lack of resources that you can fill another patient in that slot, most likely.
Well, so what you just said is a fantastic example that I had not thought of. A pain management clinic. If you have a pain management clinic, imagine if you could say, look, we have a 6-month waiting list, but let's get you started on a lifestyle medicine kind of remote program, nice and cheap, like just remote. And with the way I work with my clients, I have an app, I have some automated content, I have, it can be done very efficient, cost efficiently. And so to get them educated in that, I love to see actually cancel their appointments, because they're like, you know what, I'm sorted, thank you very much. The question is, can your pain management clinic survive the economics of that? Maybe it can, because you're right. Maybe you can bring on the people that are really dying of pain and sort out the rest that actually just need some coaching. Actually, I'm sure there's enough pain in this world to keep your clinic going. I don't know. I hope not, but it probably there is. But that's the idea. That's exactly what I'm talking about. Only you can see where lifestyle medicine will fit in if you know what lifestyle medicine is. And that would be incredible. Think of all those people waiting 6 months. Just the idea of waiting 6 months is a heartbreaker and depressing fact. But if you say, hey, start with this program we're going to start you on remotely, conveniently, cheaply, by the time they get to you, 6 months is like rehab heaven. In 6 months, you can accomplish a lot of things. By then, maybe you could do a lot. And so there are many companies out there that are finally copying onto this for musculoskeletal conditions and all sorts of things, diabetes. It's a huge and growing field. One, remote telehealth and lifestyle medicine. And when insurance companies cop onto the fact that it's cost effective, as they are now they're hiring like crazy health coaches, right? So yeah, it's the future, I think.
So how do you get patient buy-in? Because most people know, eat better, move more, like, will probably help you. Like, how do you get patients to actually buy into that and not, eat a salad instead of stopping at McDonald's? And go to the gym when they're like, oh, I'm too busy with whatever. Right.
Sorry, you broke up a little bit. Did you ask, how do I get them to do healthy lifestyle?
Yeah, how do you get the buy-in? Because I think intellectually, most people know, like, I should eat a salad instead of McDonald's, or I should work out. But even doctors, or a lot of the doctors that I talk to through some coaching that I do, like, they're like, well, there's just not time in the day. Like, I can't. Right. I don't have time to work out. I don't have time to cook a healthy meal. Like, I have to pick up whatever on the way home.
Sure. Well, that's a great question. I think it's the key question. How do you get buy-in? Personally, the way I do it is I pre-screen my clients. So I don't advertise, and when they reach out to me, I ask them enough questions that I can filter them out, because I want high success rate, right? It's good for my reviews, but also it's more it's more fulfilling for me. Like, I want to work with people that are going to be successful. And so they need to already have done some of the work, which is they're motivated, they're committed to getting this done, even though they may not know how to do it. And that's my part, the part of my job. But because there are a lot of people who are just like, yeah, do it, but I don't have the time. And they're not really even trying, right?
Mhm.
But if they have tried, then I'm more than happy to help them. And so the way to help them is to get buy-in there's a bit of an art to that, which is the coaching that you're talking about. And that I know that you've also gotten the coaching training. And so the key thing is to find their true motivators, their intrinsic motivators. What do they want out of life, right? Don't tell them what they should want, but learn what they want out of life. And so if they want to, let's say they're totally obsessed with their career, they're a big shot surgeon, and that's all they care about. Well, and they're borderline diabetics. Well, you can have a conversation and say, well, how do you feel about your vision? How do you feel about your dexterity and your neuropathy and your, you want to be a surgeon, you want to continue to operate or maybe play the piano or art or whatever it is that you do. You care about that. Well, let's keep you fit. Let's make you a fit surgeon, right? Fit for surgery. And so you want to have a good back. I've seen, I swear to God, I've rounded with a surgeon, a lovely man who had such bad chronic pain, he would go by the pharmacy and get a cocktail of medications every morning before the morning round. I mean, the guy just needed help with his lower back, but he was so unfit that he was in chronic pain. And so do you want a strong back? Do you want a good core muscles? So what is it that you need to do what you want? And that's really the key to buy-in, right? Or maybe a mother just wants to be around for her kids, of course. Well, then how you're going to be around for your kids in a healthy, sustainable way, right? And also a bit of education. If they don't know much, then you have to educate them more. If you're working with a doctor as a client, well, then you don't need to educate them. You need to raise the accountability, right? Doctors will say, yeah, I know that. I know all that. Well, I know you do. It's not about knowing, it's about doing it. And so I'm going to hold you accountable and no excuses. It's called the West Point method, right? Yes or no. Did you do it or did you not do it? Don't give me excuses. And it's not about judgmental. It's not being about judgmental. It's about being true to yourself. And it's not about, if I'm your coach, it's not about me. It's about you telling yourself the truth. So did you eat a salad or did you go to Burger King, right? It's a yes or no question, right? And so there's a part of coming to terms with reality. Now, as a former surgeon, I know what it's like to steal food from the patient's tray and eating whatever you can find, raiding the kitchen in the middle of the night. I know all about that. And I feel for the people who are still doing that. But in retrospect, there are better ways. And towards the end of my training, I did do it better. I would pack like $10 salads that were all fancy and stuff, but I was buying them and I was packing them for my own calls. So there was a better way, right? It comes down to prioritizing these behaviors. For instance, most people say, I don't sleep enough. I can't find more hours in a day to sleep. Really? Well, most of us do spend about an hour on the iPad before we go to bed. So come on, let's get real. You can find that hour. It's just that you're not in the habit of doing that, right? And so you can carve out the time to prioritize sleep if you really, really want it, right? One way to get buy-in for that is to remind my clients that when you go to bed together with your spouse and you give yourself time to ease off and into bed early, like 9:30, 10, you get more intimate time with your spouse. You get to talk more and you get to communicate away from the kids when you actually can talk about things that matter. And so all of that is so much better just because you went to bed together and earlier, right? And then you wake up in a better mood, right? Ready and energized because you slept better. So things add up. The other thing to get benefits, one key thing that I do is no matter whether they want to lose weight or they want to cut down alcohol, whatever goal they have, I always start with sleep. Because if you optimize sleep by just adding a little bit of time, you get less cravings, more willpower, better mood, more energy, more of everything, so that they can maybe go to the gym or maybe make the better choice for breakfast, or have less sugar in their coffee. But if you establish that baseline of sleep, it makes a world of a difference. And in fact, my very first client ever was a lady in New Zealand. She had all these issues that she wanted to solve, but I got her to start with sleep, and she herself fixed everything else because her mood was better. She stopped putting sugar in her coffee, and like it's just everything was just a chain reaction. So I always start with sleep. It is the foundation of good health. I know it's a cliche, but it's true.
Yeah, it's absolutely amazing. Like when you get good quality sleep, and you really, I recently have kind of prioritized that more, and even gamifying it almost, that I recently got an Aura ring. So every day you kind of look at what your, sleep score was and what you did the day before and whatnot. And so really those days that you slept well, and even, I've been getting up earlier and working out before everyone else wakes up, just how much better you feel during the day and how much clearer you are.
Absolutely.
From
Absolutely.
better sleep, and then from the exercise, absolutely.
Yeah.
But I think the accountability portion is really key. Also,
I can't say enough about it.
I'm actually in about.
What's that?
I say I'm part of a couple mastermind groups, and I actually am meeting with my group in about an hour. Kind of a small accountability group that we meet once a week, and we you set your goals for the week, and you better have accomplished it when you come back to the group, or else.
That's great.
So
Very
this
cool.
has been excellent. I really appreciate it. This has been a ton of valuable information. How can the guys get in touch with you and to learn more about yourself and lifestyle medicine in general?
Sure. Actually, thank you for asking that, because I was going to say, when you asked me how can they learn more, I'm more than happy to. If anybody wants to reach out to me, I'm more than happy to direct them in the right way, or maybe introduce them to the right person about lifestyle medicine or health coaching or whatever. But yeah, absolutely. So I can be reached by by Facebook or LinkedIn. Maybe I can send you, I don't know if you do show notes, but I can send you the links. But Victor Peña-Araujo, Araujo, or my website, myelitehealth.org. That's my website. It's Elite Personalized Health, and they can reach out and send a message that way. Or through you, of course. I would appreciate it if you forward any messages that if anybody sends one to you.
Absolutely.
But yeah, I think it's important to kind of my motivation is to save people the learning curve that I experienced. I'm not complaining. It was an exciting time, but if we can kind of streamline the process of learning about it and finding out if it's for their practice or for themselves personally, let's do it. So reach out to me anytime. I'll send you all the links.
Wonderful. I appreciate it. And have a good day.
Thank you so much,
Thank
Adam.
you.
Best of luck. Take care.
You too.
Bye-bye.
You've been listening to the Dads Before Doctors podcast. Family men who are doctors rather than doctors who have families. In an evolving and ever fast-paced world, we cannot lose sight of our real priorities. We hope you enjoyed the show. We know we had fun. Make sure to like, rate, and review. And tell a friend about the show. We hope you've gotten some useful and practical information from the show. And we'll be back soon. But in the meantime, hit the website at dadsbeforedoctors.com. Questions, comments, suggestions? Email adam@dadsbeforedoctors.com. And find us on Facebook and Instagram at Dads Before Doctors. Remember, the host of this show is not your doctor, your coach, or your financial advisor. This show is strictly for entertainment. Till next time, this is Dads Before Doctors, signing off.